Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand. Now I am going to demonstrate to you how to test 7th cranial nerve or facial nerve. Now like all nerves, we have two of them, and primary function of facial nerve is to supply muscles of facial expression. You know, we have many muscles in the skin of the face which help to show our expressions, our gestures. So this nerve comes out from the pons. Of course, if it has got upper motor neuron connection, but the lower motor, the nucleus is present in the pons, comes out and then passes through the middle ear. While it passes through the middle ear, it gives a branch to stapedius muscle, which regulates our membrane, the drum movement, comes out, and then it passes through the parotid gland and then supply the entire face. Now this left facial nerve will of course supply the left side, the forehead, and these muscles, the lids, and then these muscles, and then all these muscles are supplied by the 7th cranial nerve. So when we test it, now 7th cranial nerve paralysis can be of upper motor neuron type or lower motor neuron type. Mostly it is lower motor neuron type because the commonest cause is what is called idiopathic facial palsy or Bell's palsy. We call it Bell's palsy because Bell was the person who described it first of time. And it is inflammation. It is supposed to be some viral infection. There is inflammation of the 7th cranial nerve when it comes out of the bone and it gets compressed and the entire face is paralyzed. So that is one thing. And upper motor neuron 7th nerve paralysis may occur as a part of stroke. For example, somebody has brain hemorrhage or ischemic stroke that affect the entire half of the body including face. So it is easy to differentiate between upper and the lower motor neuron type of paralysis in facial nerve. So how do we do this? First of all, I think we can tell the moment you see the patient from his facial expression, you can tell that this patient got 7th cranial nerve palsy. So there may be asymmetry of the mouth. I think something which is most obvious is the asymmetry of the mouth. Mouth may be deviated to one side. So you could tell from the inspection, but then you have to perform the test formally. First of all, I'll ask him to make wrinkles on the forehead. ऐसे गुस्से से ऊपर कर ऐसे. So he can do it very well. You can see the wrinkles, symmetrical wrinkles on both sides. Then I'll ask him to close his eyes forcefully and I will try to open them. And in a normal healthy person, it is actually not possible to open one's eyes against his wish. आंखें बंद करें. No, if it is marked paralysis, then he will not be able to close eyes at all. Actually, when he is trying to close eyes, his eyeball will move upward. This is called Bell's phenomenon. Because eyelid cannot come down, so eyeballs move up in an attempt to cover the eyeball. So, आंखें बंद करें पूरे ज़ोर से, बड़े ज़ोर से पूरे. Now, I'll very gently try to open both eyes from here using the same level of force on both sides. I'm unable to do it. Similarly, I could do it from here. So I'm unable to open his eyes and he can close them very well. Now then I'll see this part also. Zara muh mein hawa bhare. He can do it. In cases of facial paralysis, the air will leak from one side and he will not be able to hold air. Band kar de, daan dikhaएं. So you ask a patient to give a big smile or show upper teeth. Normally when you do this, both angles move laterally, equally, symmetrically. And if one side is paralyzed, this angle of mouth will move toward the healthy side. This we have already discussed. It will move the healthy side and the paralyzed side is actually moved to the healthy side. Then we may ask the patient to make a whistle. ऐसे करें, हवा भरे, हवा. नहीं सारी स्वीटी बजाएं. So he can do it. There is no problem. And then maybe we can test the hearing also in cases of 7th nerve palsy. If the stapedius muscle is involved, then there may be hyperacusis. In some cases, of course, that is rare, and you may see some vesicles here that indicates the herpes zoster lesion, and that is called Ramsay-Hunt syndrome. That is very rare, but mostly facial palsy is of lower motor neuron type and is idiopathic. There are no other signs, and anybody can develop it at any time. Luckily, the prognosis is not bad. So one thing you may be asked how to differentiate upper motor neuron lesion from the lower motor neuron lesion. One thing is very simple, that in upper motor neuron, forehead is spared because forehead part has got bilateral upper motor neuron innervation. So practically speaking, if you're shown a case in the examination and if you have facial palsy, I think 99% chances are that it is lower motor neuron palsy. Thank you.